So how do you decide that this patient is entirely futile? So I think what we end up doing, and is probably more appropriate, rather than simply stripping autonomy from the decision, is working with the family to understand what are the goals of care for the patient. If that patient's living independently, like Shawna had talked about, is so crucial to them, we know that over a period of hours to days, that this is going to be at best a very long ICU stay with a rehab stay after that. And the likelihood that the patient's going to get home anytime soon becomes almost impossible. So what you do is, rather than making a simple decision and saying this patient has no chance to survive and going against the family's will, is working over several meetings with the family for them to understand the goals of care. And then the other thing you're doing, though, is you're also buying more certainty. As the patient is there and as they're escalating in vasopressor, you're seeing whether or not they actually responded to therapy. We become more certain the more data points we have in time. The patient, as Dr. Strickland described, is actually probably already in a slow code. The vasopressor levels are almost near what you would be using in a code. So you know at this point in time, after doing everything to see if you can forestall disease, that that's all failed, that now there's more certainty. Again, are you willing to, if the family's begging you to keep pushing on, would you invoke futility? I think most of us would struggle with that because, again, how certain do you need to be? But it's incredibly rare in my experience to have to keep going when you are linking the patient's situation with the goals of care, and the family typically comes around to understand that this is no longer consistent with what their original image of survival was meant to look like.
So having understood that, what is the next appropriate step? What should we be doing at this point in time? And while there are no wrong answers, because as Dr. Rubinson was talking about, we have some options and we could make some sort of positive impact on her health, though it is unlikely. The ethics consultation can help us come to some sort of resolution, and it's important to understand that even if you don't provide an ethics consultation, if you don't have an active ethics committee, there are other resources that can be pulled together to help the patient's family come to some sort of resolution to the situation. Our social work colleagues are very important. They can help liaise between the healthcare team and the patient's family to help them understand the issues, put these potential medical jargon and difficult concepts into some understandable pieces of information, perhaps provide some sort of social support or help them get into a nearby housing venue so they don't have to make long trips. There are a lot of pieces that our social work colleagues can bring to the table to help the family with this very difficult decision.